Across the province right now, there are 36 vacant clinical psychology positions. This time last year, there was 39. So over the last year, the province has hired 3 new clinical psychologists, 2 for Eastern and 1 in Western Newfoundland. But that still leaves massive gaps across the system. Gordon Piercy is president of the union representing them.
I don't think we've been real successful in bringing in a whole lot of new talent, and I don't think any of the people who left originally came back.
In January, the province announced it would entice medical professionals, including psychologists, using cash. They offered $50,000 for Newfoundland and Labrador born and trained psychologists with an exchange for 3 years of service, $25,000 for non-locals. But with the addition of just 3 hires in a year, Piercy says it proves that money isn't everything.
Workloads are increasing, and the type of cases, Ariana, are also getting more and more intense and more complex. We're hearing a lot of that from our membership as well. So there's a lot of pieces that need to be addressed. Some of them are not cost-driven.
Piercy says psychologists want to feel valued by their employer and use their full scope of practice. All of this, he says, isn't just affecting the mental health system, but the mental health of those psychologists.
We know situations where some of our members' mental health, they struggle with their own mental health, caring for others. That's not right.
We won't sit on our hands. We will work on these issues.
Tom Osborne acknowledges nearly 40 vacancies isn't a good thing, but says psychologists are no longer leaving at the rates they once were.
We need to focus on retention of those we have, in addition to increasing the numbers. We're in a globally competitive environment in terms of recruitment. There's a shortage of clinical psychologists across the country. So to have increased it by 3, we are headed in the right direction.
The health minister says he struck a working group to deal with the issue of retention. He says that group will begin its work as early as next month. Ariana Kelland, CBC News, St. John's.